Have you ever seen a person washing their hands again and again, even when they are already clean? Have you noticed someone who is extremely afraid to go outside, even though there is no real danger? Or a person who hears voices that no one else can hear? To an outsider, such behaviors may appear strange, sometimes even frightening. But psychology teaches us something very important. Abnormal behavior is not drama, it is not attention seeking, it is not a sign of weakness. It is the mind's way of communicating distress. Just like pain is the body's way of communicating injury. Behind every abnormal behavior, there is emotional suffering, confusion, or imbalance. Today, we will understand why human beings sometimes behave differently and how psychology explains such behavior scientifically. So, now let us clearly understand what psychological disorders are. Psychological disorders are conditions in which a person's thoughts, emotions, moods, or behaviors become disturbed to such an extent that they cause significant distress and interfere with daily functioning. Daily functioning includes studying, working, maintaining relationships, taking care of oneself, and making decisions. For example, feeling sad for a day is normal. But feeling hopeless for weeks, losing interest in studies, and withdrawing from people indicates a psychological disorder. Similarly, feeling anxious before an exam is normal. But being so anxious that one cannot sleep, eat, or enter the examination hall is not normal anxiety. Psychological disorders are real conditions. They are influenced by biological, psychological, and socio-cultural factors. They are not caused by lack of willpower or character. Wakefield's concept of harmful dysfunction. Psychologist Jerome Wakefield defined mental disorder as a harmful dysfunction. According to Wakefield, a disorder exists when a mental process fails to perform its normal function and causes harm to the individual. To identify abnormal behavior, Wakefield proposed the 4 Ds of abnormality. The first D is deviance. Deviance refers to behavior that deviates from social norms, for example, laughing loudly at a funeral or talking to oneself in public. However, deviance alone does not mean abnormality, because cultural context must be considered. The second D is distress. Distress refers to the emotional pain experienced by the individual. For example, intense fear, sadness, or anxiety without a clear reason, even if behavior looks normal from outside, internal suffering is important. The third D is dysfunction. Dysfunction refers to the inability to perform daily activities. For example, a student who stops attending college, neglects hygiene, or cannot concentrate on studies. The fourth D is danger. Danger refers to behavior that threatens the safety of the individual or others. For example, suicidal thoughts, violent behavior, or severe self-neglect. Usually, abnormality is identified when more than one of these Ds are present together. Now, let us understand classification. Classification of abnormality, DSM and ICD. Classification means grouping psychological disorders into categories based on similar symptoms and characteristics. Classification is necessary for accurate diagnosis, effective treatment, clear communication among professionals, and research purposes. The most widely used classification system is the DSM, that is, the Diagnostic and Statistical Manual of Mental Disorders. published by the American Psychiatric Association. DSM classifies psychological disorders into categories such as anxiety disorders, somatoform disorders, dissociative disorders, mood disorders, schizophrenia and psychotic disorders, neurodevelopmental disorders, and substance-related disorders. Another important classification system is the ICD, the International Classification of Diseases. Published by the World Health Organization, ICD is used worldwide and includes both physical and mental disorders. For exam purpose students, you should just understand the purpose of classification rather than memorizing the table. Now, let us look at history of mental disorders. To understand abnormal behavior deeply, we must understand how societies viewed mental illness in the past. In ancient Chinese, Hebrew, and Egyptian civilizations, abnormal behavior was believed to be caused by evil spirits or supernatural forces. Treatment involved prayers, rituals, and exorcism. Hippocrates, the Greek physician, was the first to reject supernatural explanations. He believed that mental disorders were caused by imbalance of bodily humors. This marked the beginning of medical explanations. Plato believed that psychological disorders were due to conflicts within the soul. He suggested that rational decision and guidance could help in treatment. During the 16th century, asylums were created to house mentally ill individuals. Unfortunately, conditions were inhuman and patients were treated with cruelty. In the 19th century, reformers brought a positive change. Franz Anton Mesmer introduced hypnosis, showing that mental disorders could be influenced psychologically. This shifted treatment from punishment to therapy. Emil Kraepelin developed the first scientific system to classify mental disorders based on symptoms and course of illness. This laid the foundation for modern systems like DSM and ICD. In the 20th century, Sigmund Freud emphasized unconscious conflicts as the cause of abnormal behavior. He believed that mental patients should be treated with empathy, care, and understanding. Now students, let's look at the factors influencing psychological disorders. Psychological disorders do not arise due to a single cause. They develop due to the interaction of multiple factors. The first group is biological factors. These include genetic inheritance, neurotransmitter imbalances, hormonal disturbances, and brain injury or disease. For example, schizophrenia has been linked to excess dopamine activity, while depression is associated with low serotonin levels. Brain injury may cause emotional instability or personality changes. These factors show that mental disorders have a strong biological basis. The second group is psychological factors. These include early childhood experiences, emotional trauma, faulty learning, maladaptive thinking, and unresolved emotional conflicts. For example, a child who experiences neglect or abuse may develop anxiety or depression later in life. A student who develops irrational beliefs such as I must be perfect or I am a failure may experience chronic stress and anxiety. The third group is socio-cultural factors. These include family environment, academic pressure, poverty, unemployment, social isolation, and cultural beliefs. For example, excessive academic pressure can trigger anxiety disorders in students living in a critical or unsupportive family, may lead to low self-esteem and emotional insecurity. Social stigma may prevent people from seeking treatment, worsening the disorder. Modern psychology explains abnormal behavior through the diathesis stress model. According to this model, a psychological disorder develops when a person's vulnerability interacts with stressful life events. For example, two students face the same exam stress. One develops severe anxiety while the other copes normally. This difference occurs due to variations in vulnerability. So students, what we studied in this video is only the introduction to chapter 4 from your syllabus. This is part 1. We shall study all major psychological disorders in detail, including their symptoms, causes and examples in the next video. So do not miss the second video because only then you will understand chapter 4 of your second PUC Psychology completely. Psychology teaches us empathy, understanding and scientific thinking, not fear or judgment.